time of unknown.
The COVID-19 pandemic creating fear.
If he's to get this, he's too fit.
Straining our hospitals.
And our resources are being not deployed as they should be.
Closing up shops and shutting down businesses. Halting Tennessee's economy.
I don't know how long it's going to be until we get to come back to work.
Now, as the road to reopening begins, it's time to look at how Tennesseans will recover, how businesses will bounce back, and what are the next steps for our great state.
I'm here just to find out why we're not getting any government assistance like we were promised.
Tonight, the leaders at the forefront of shaping our fight against the coronavirus answer your questions and share their vision for how Tennessee will get through this.
Not just throwing open the doors, we're going to take this slow and methodical.
We are ready to reopen Tennessee.
You're watching our COVID-19 Tennessee Town Hall meeting, sponsored by Ionogen.
Good evening, everyone, and welcome to our COVID-19 Tennessee Town Hall meeting. Thank you for joining us for this important discussion. Governor Bill Lee, we have breaking news, was asked to join President Trump in Washington Thursday afternoon, so we spoke with him earlier today, and I am pleased to welcome the governor of the great state of Tennessee, the Honorable Bill Lee, along with Tennessee's Commissioner of Health, Dr. Lisa Piercy, to share their expertise with us. Governor, Commissioner, thank you so much for taking part in this COVID-19 town hall meeting. It's important information. We will be broadcasting this town hall across the state. We welcome our WKRN viewers here in Nashville, along with viewers from our Tennessee sister stations, WATE in Knoxville, WREG in Memphis, WJHL in Tri-Cities. We also have partnered with WRCB to broadcast this program to viewers in the Chattanooga area. Governor, I have to ask you about the breaking news of the day. The president wants to speak with you as a governor who is on the front lines of this reopening. What will you tell him, sir, that is working well here in Tennessee? What do you still need help with?
Thank you, Bob. Thank you. First of all, let me just say thanks for having this town hall opportunity for us to speak to Tennesseans all across the state. You know, we do press briefings every day, and we try to get information out because we want Tennesseans to know exactly what they need to know regarding COVID-19, regarding our economy, regarding the steps that we're taking. So I really appreciate the fact that you're doing this. And I appreciate what President Trump, his leadership in this effort. He has worked closely with governors. He and I have spoken several times. I've been on phone calls with the White House and a number of governors all across the country. As we work together to share best practices, he has asked me to come up there today, and at the time of this broadcast, I will have already met with him to talk about particularly vulnerable populations. The White House is focusing on the elderly and particularly those in long-term care facilities, as we are. We've put a special emphasis and focus there, just recently announcing that we're doing widespread testing in every nursing home, all 750 of them across our state. The White House wants to talk about that with us and to talk about the efforts nationally that we can make to protect the vulnerable. So I'm honored to be asked to be there, but most grateful to be able to talk with him and other leaders across the country about how we can protect the elderly in particular.
We'll be taking questions, Governor, from viewers across the state a little later. I want to begin, though, with the rationale for reopening Tennessee. You heard all the loud voices, those who never wanted the state to shut down, those who wanted to reopen much sooner, and now those who say it's simply too soon to open. For both of you, what was the statistic, the finding, the metric that says now is the time that you feel that Tennessee can reopen and reopen safely? Governor, let's begin with you.
I'm glad you asked about, what was the statistic. There's not one statistic that makes that decision. Bob, this has been an incredible season, certainly historic. I like to say Tennesseans have been hard pressed on every side, but we're not crushed. We are resilient as a people. We followed information and data through the decisions to close certain businesses and to get in the closing down process. And then we followed that same information and data in the decision to begin to crack the door to open our economy back up. A couple of those points, and Dr. Piercy can elaborate on those, are downward trajectory of positive cases, a downward trajectory in what we call the positivity rate, the stabilization of our healthcare system, the number of available hospital beds, the number of available ventilators, the capacity that we have to treat the sick. Those are all data points that have been important in this decision to crack the door open. And the data point that 1 in 6 Tennesseans are not working. 400,000 Tennesseans unemployed as a result of COVID-19 and the impacts of that in our state. All of those factors have weighed into the decision to uphold the health and safety of Tennesseans first, but to begin to crack the door open to our economy to let Tennesseans go back to work. A very important decision for us.
Governor, you've obviously done this before. Nice segue to Dr. Piercy from the health aspect. What was it that said, Dr. Piercy, we can do this and we can do this in a safe way?
Yeah, we can. Thanks for having us today. You know, this is a new virus and we're learning more about it every day. And especially for those of us in the healthcare field, but really for everybody, when you're dealing with something new, it can be intimidating. But I want to reassure you, infectious disease and even pandemics, those aren't new things for doctors and public health officials. Our job is to bring the data and the science to both the public and policymakers so we can all use the most evidence-informed approach in our decision making. But most of all, our main job is to ensure that all Tennesseans, especially those that are most vulnerable, have access to the testing and the care they need so we can have the best possible outcomes. And that's why the Department of Health, Unified Command, the Governor's Office, and every single one of us here in this administration focus every hour of every day on making sure that Tennesseans have the best possible outcomes.
I want to talk about contact tracing a little bit. This is part of President Trump's guidelines. Ideally, they're saying about 30 contact tracers needed for every 100,000 people. Do the math, 6 million people in Tennessee. It's about 1,800 tracers. Do you have that many currently? Dr. Piercy, how will you start this process, or has it started already?
Yeah, it actually has started already. So, you know, we keep contact tracers on staff all year round, even when there's not a pandemic, because just like I mentioned, we fight infectious disease all year round. And so we have about 70 or 80 on staff full time. The first step that we took is we looked at all of our employees and said, okay, who can we bring in to help do these tasks? Then the next phase that we did is we asked for volunteers all across state government to say, would you be willing to be temporarily reassigned to come and help us do this calling and tracing and making sure that these patients have daily contact while they're ill? And so we got about 230 additional folks to come over. They started last week and they're calling patients probably as we speak right now and making sure that we're ramped up on those efforts. We're working another 2 courses of action to bring on additional cohorts of those contact tracers because if and when our cases grow, we are going to need more contact tracers, and so that's something we're pursuing actively.
I want to talk to you about nursing homes now. Long-term care facilities are proving to be hotbeds for COVID-19, accounting for more than 470 cases, at least 44 deaths. On Wednesday, you did announce a plan to push forward widespread testing of these facilities. Dr. Piercy, again, how is that going to begin, and how will this help if there's a future outbreak in these cases in regards to containment, those kinds of things?
As the governor mentioned earlier, the elderly, and particularly those in nursing homes, are the most vulnerable population in Tennessee. And one death is one death too many. Unfortunately, sometimes even when facilities do everything right, they still have an infection that gets into their facility. And because the older folks can be more immunocompromised, their immune systems can be weaker than younger, healthier people, they tend to get the disease more often. And something that we found interesting is that they actually seem to be asymptomatic longer or pre-symptomatic, which means they can look well, but actually have the disease that doesn't show up until later. So when there is a case in a nursing home, we get in there, we work with them both on-site, over the phone, and through technology to make sure that they can mitigate and contain in order to lessen the number of cases that they have. And then, as you referenced, we did announce yesterday that we are launching a mass widespread testing effort in all of our long-term care facilities to test all of the residents and staff across the 700 plus facilities we have in the state. That is a huge undertaking, and it's going to take us several weeks to get through that.
Governor, Dr. Piercy said this is a vulnerable population, and it's never an easy decision, but should it have been a sooner decision to maybe lock these down, to stop visitations taking place now that we're seeing what happens inside and how quickly it does spread?
You know, we in January started notifying nursing home facilities about coronavirus. I actually had met with the CDC in January about this before really we knew the extent to which this would be a problem. We knew it was potentially a problem, but no one knew how great an issue it would be. So we started early with our nursing homes, and we made a decision actually before the CDC recommended limiting visitation to nursing homes. We made that decision early because we knew that this was the most vulnerable group. You know, I talked to Dr. Piercy early and said, we want to make decisions in this state around the elderly and around long-term care facilities based on the concept that, or the idea that what if my mother, I have an 86-year-old mother, what if she were in that long-term care facility? What would I want us to do as a state? We talked about that weeks ago before we started the real, intensified efforts. One of the challenges, of course, that the entire country faced was because of the rapid spread of this across the country, the amount of testing that was available 3, 4, 5 weeks ago was substantively different than the testing that's available today. The possibility of testing every worker in every nursing home 4 or 5 weeks ago, that was not a possibility for our state because of the limited resources we had from a testing standpoint.
Governor, another topic that affects many, many Tennesseans who are watching this today, the cancellation of schools that is done for this year. Fall will be here before we know it. A viewer sent a question to our sister station, WJHL, asking if you are getting ready to implement any kind of homeschooling scenario for the upcoming school year. Also, have you developed yet or working on guidance for districts on social distancing, how to keep students and staff healthy? Do you believe classes will be able to go back in full session this fall? Governor?
Well, do I believe classes will go back in the fall? I certainly hope so. And there are a lot of families out there with kids at home trying to manage this pseudo homeschooling process that hope so as well. Our Department of Education has worked really hard to do a couple of things. First, to take care of those kids to the degree that we can while they're out of the classroom and the structured classroom with food, first and foremost, because a lot of kids receive their meals, many of their meals, through the classroom and through the school system. So we've worked really hard to develop partnerships all across the state and make sure every kid gets fed that was getting fed in the classroom. But secondly, not just to take care physically of kids, but to continue the educational process forward. And Penny Schwinn, who is our Commissioner of Education, has worked tirelessly and relentlessly with districts all across the state to create distance learning where possible. So to have online learning for students. I know my own grandson, who's in the public school system here in Davison County, yesterday my wife went to pick up the grandkids, and he couldn't be picked up at the time because he was doing a Zoom conference with his teacher and working out problems online. That's happening in districts all across the state. But there are also kids who don't have the kind of technology that can, for whom that can happen. So there are learning packets that families are picking up. We developed a partnership with a public television station all over the state. So homes that have television can utilize this partnership. And those are actually Tennessee teachers teaching Tennessee subjects, but being broadcast across the state. There is a real effort to make sure that the educational process doesn't end in Tennessee, and I think we're going to be pleased with that process. Again, I'll say, I sure hope we can go back to school in the fall, but I can tell you the department will be working to make sure that in the meantime, kids get what they need.
I think a lot of parents feel the same way. Thank you, Governor. We've covered a lot of ground. There's much more to talk about. When we return, Tennessee, is it ready for the potential resurgence of this virus later in the year? We'll ask that question.
You're watching our COVID-19 Tennessee Town Hall meeting.